Segal would like to welcome you to today's webinar presentation, Multi-Employer Plans and the Health Insurance Exchanges, What Trustees Need to Know. Now I would like to introduce our speakers. I will start with Chris Hepner. He is our Vice President, Health Actuary, and our Health Practice Leader. Andrew Sherman, Senior Vice President and Benefits Consultant. Joanne Husted, Vice President, Senior Health Compliance Specialist. And David Blumenstein, our Senior Vice President, National Director of our Multi-Employer Consulting. And now I'll turn the call over to David.
Thanks, Liza. Welcome to our webinar about multi-employer plans and the health insurance exchanges, what trustees need to know. As Liza said, my name is David Blumenstein. I'm the National Director of Multi-Employer Consulting here at Segal. We believe now is the right time to discuss this aspect of the Affordable Care Act for a couple of specific reasons. First, the state exchanges are supposed to go live in about 15 months, and the open enrollment period to sign up for the exchanges is in less than 1 year. But perhaps more importantly, all employers must notify employees about the existence of the state exchanges no later than March 2013, which means that trustees will be getting questions about the exchanges from members and employers alike. We want to make sure that as trustees and leaders in your businesses and unions, you're in a position to debunk some common misunderstandings and answer important questions about the exchanges. We also think this material will be of interest to others, to fund advisors like third-party administrators and attorneys. So as the agenda slide outlines, we'll be reviewing 5 different areas today. The first area we're going to be going over is what are health insurance exchanges? We'll then be moving into how might those exchanges affect multi-employer plans. Third, how does the premium assistance tax credit work? 4, how can exchange modeling help make sense of all of these various elements for your fund? And 5, what are the continuing strengths and advantages of multi-employer plans? Now it's my pleasure to turn the presentation over to my colleague Joanne Husted, who will review the first question. What are health insurance exchanges?
Thank you very much, David. As you know, one central goal of the Affordable Care Act is to lower the number of uninsured people. And there are lots of different ways that the ACA attempts to accomplish this, and all of these changes take effect in 2014. First, there's the individual mandate. This is the requirement that people have health coverage in place or pay a tax penalty. I'm sure you're all very familiar with this requirement. It got a lot of publicity as a result of the litigation and the Supreme Court decision, which resulted in the mandate being upheld at the end of June. Another mechanism is eliminating pre-existing condition exclusions. This is not really an issue in the group market that we all work with, but it is very much an issue in the individual market where health insurance companies basically refuse to cover people who have medical problems, or they charge them a lot more money. The third way that the ACA approaches this issue is by expanding Medicaid to all people under age 65 with incomes up to 133% of the federal poverty level. This is a very major change in the Medicaid program and the eligibility requirements for Medicaid. However, as a result of the Supreme Court decision, this expansion of Medicaid will be decided on a state-by-state basis. Rather than all states being required to do it, this is an option that states may take advantage of or not. We anticipate that many states will, some states won't, and some states may take their time in expanding Medicaid. What we're going to focus on today are the other 3 mechanisms in the ACA for improving access to health insurance coverage. We're going to be talking a lot about the exchanges. We're going to talk about the subsidies, the tax credits that help lower income people buy coverage in the exchange. And we're going to talk about the financial incentives that large employers have to provide coverage to their full-time employees.